Hello friends, welcome back to my channel. Today I'm going to continue the second part of clinical decision making. Those who were not able to watch my first video regarding clinical decision making, I would highly recommend you to start from there. And in that video, I have finished two parts: the psychology of cognition and the being methodological, paying attention, and taking a diagnostic pause. Now, I'm going to start in this video about the cognitive forcing and reflective medicine. A number of strategies helps to improve diagnostic accuracy. Once such approach is cognitive biasing, the conscious considerations of cognitive bias and of their potential impact on the decision by considering questions such as what I'm missing, could I be wrong. Diagnostic accuracy may be enhanced through increased experience to sharpen intuitive thinking, which is recognizing the pattern of the disease. People are coming with the similar typical symptoms, complementing existing knowledge and skills by obtaining additional information, especially for unusual presentation or challenging cases. Consulting with the experts, some people who are specialized in those things, we can ask them, and obtaining a second opinion from your colleague or a peer, and seeking additional information from the patients. All of these things will reflect back and give us the cognitive forcing and reflecting how can we diagnose a case and which should be diagnostic accuracy. Reflection may be effective. Reflective practice to triggers and elevate cognitive awareness is also one of the part. So there are three different parts they're talking about, and they're talking about why we are doing this. We are doing this for the diagnostic accuracy. Reflection may have been an effective strategy to promote cognitive refocusing and mitigating errors in thinking. Slowing down, when you said, is a mark of expert judgment. Slowing down does not refer to thinking slowly or employing system 2 thinking, but rather the conscious effort to consider possibility of diagnostic error, or to focus on maintaining situational awareness and to consider other possibilities before making a final decision. This situational awareness is one of the part of the good practice from the physician team, so which I'm gonna read it later on. I'm not gonna read it now, but this is very, very important when you are doing any kind of decision making. You should be aware about the situations. It could be external factor, it could be internal factor, it could be the state of the patients, and the things around the patients is giving them an kind of a symptoms or kind of a presentation kind of thing. So all of these things also we need to focus, and we need to maintain that we are aware about the situation, and then doing a possibility and finding out is there any kind of diagnostic error can be there. Reflection in action, thinking about an activity or reflecting on it while carrying it out, and reflecting on action, reflecting on an activity after carrying it out may mitigate for deficiency in thinking and promote safe care. Reflecting in actions, which is the first one, occur during the course of patient's care. The pause or the slowdown allows provider to reflect on the evolving of the patient's clinical situation. Slowing down when you should allows provider to shift their thinking from a primary intuitive and automatic approach towards a more analytic one, in an attempt to mitigate the cognitive and effective biases. If you have watched my first video, then I have talked a little bit about cognitive and effective biases, but this is a very huge separate topic which will be coming in one of the good practice, so we can learn that. But right now, what they are trying to say is, when you are trying to decrease the error in making accuracy of the diagnosis, you have two different things. One is inaction and one is on action. Inaction, while you are caring for the patient is still in front of you, so you can slow down, you can try to find, is there anything else which I can do it by keeping my awareness of my biases, and by actively maintaining their attention and switching from automatic decision making to the analytical decision making, means going from system 1 thinking to the system 2 thinking. Expert diagnosticians may combat distractions, fatigue, or any biases. So that was the one of the things we are talking about. The external factors can also affect physicians capability of diagnosing a case, and remain flexible to nuances in the clinical presentation and involving of the patient's course. Listening up is a key skills in slowing down. When you have a case unsure what's happening with the patient. You don't know, you're slowing down, you're discussing with your colleague, you're discussing with your junior, you're trying to find out the expert or the specialist opinion, you're doing things. So when you slow down and you rethink and reconsider everything, then there might be a light you will which will enlight in your brain, and you'll say, oh, this might be the one thing we are missing, or this might be the thing we can try to find out the answer. So these types of things we talk about, and listening up is also one of that. As this is a blue, I would say this might be one of the good practice, and we will definitely work on this listening up later on. I'm not gonna do it today. Situational awareness, as I was telling that we need to learn a little bit, I think they are already giving a very good overview of situational awareness, so it's a good thing. Is it critical for effective clinical decision making? Why it is critical, why it is important? It can be achieved through collaborative decision making during a team rounds, huddles, timeouts, debrief, and briefings. These team activities allow insight from others who can provide alternate suggestions and solutions. Situational awareness is the resources available around you, the people, like any resident, any nurse practitioner, any other allied health services which are there, any huddles times during the timeouts when you don't know what's happening, you're not able to figure out what's happening with the patients, during a briefing or debriefing things. That will help other people to open up for the suggestion. That's why the leader should be listening up. Listening up is also one of the best quality to find out if someone's else have some decision and can I suggestions, and I can consider that suggestion to make my decision. Team must similarly engage in a cognitive forcing strategy to mitigate the risk of groupthink bias. Groupthink bias can be mitigated by challenging consensus opinion, alternating team to red flag, alerting teams to red flags, suggesting potential alternative course or decision, contingency planning. The culture of psychological safety. Now, when someone says we have a team, everybody should speak up. Physician is listening, but if physician is really giving you that safety environment, that means your brain is psychologically safe as being a junior resident or being a student, you are taking your part and so throwing up your suggestions. That's a very important thing. And speaking up and listening up is very, very important, and that will only happen when you feel the person who's going to speak and the person who's going to listen is having a connection of safety. Nobody is trying to suppress someone else. So speaking was critical to reach better decision by the team. The process begins with appropriate preparation like team briefings, reviewing the medical records, handovers, rounds, planned timeouts like surgical safety checklist. These structures team processes force the team to slow down when it should be at the preparation phase of the clinical decision making. This allow healthcare provider to confirm informations about the specific patient, the environment, the task, and the time or the urgency. So these are all the things why we are talking about these, because this is a very important part when you are making a decision about the patients, about the diagnostic, because whatever their diagnosis is, you will manage the patients accordingly, right? So that's one of the things.